webinar. The title of the webinar is The Transition to ICD-10, Building the Bridge as You Walk on It, and it's supported by Beacon Partners. I'm Lori from HIS Talk, and I'll be moderating. I'd like to introduce our speaker for today, Chris Kalish. Chris serves as the National Practice Director for Operational Strategy and ICD-10 at Beacon Partners. In her role, she leads strategic planning efforts, organizational assessments, and business development projects in all areas of the clinical practice with a focus on academic medical centers. With that, I'll turn it over to you, Chris.
Thanks, Lori, and good afternoon, everybody, or as Lori said, depending on what area of the world you happen to be in. So I want to thank you for being here with us today. And the focus of today's conversation is about the transition to ICD-10. And I chose this title and path because it's how we at Beacon and actually myself personally see this transition. So one of my favorite transformational and deep change subject matter experts is Robert Quinn. And in his book, Building the Bridge as You Walk on It, he made the comment that when we commit to a vision to do something that has never been done before, there is no way to know how to get there. So we simply have to build the bridge as we walk on it. So today, within the context of the ICD-10 transition, that's what we're going to talk about it in the agenda. Take 2 minutes just to get up to date on ICD-10. Define key strategies in the transition, and I'll talk to you about exactly what that is. Realistically identify the work to be accomplished. Look at assumptions and constraints for the program and related projects. Creating your organizational structure, and then also figure out how to use your resources and your partners very effectively, considering the fact there's a very short period of time to finish everything we have to do. And then we'll have some questions. And throughout this discussion, I would like for you to think about how you as a leader or a consultant, a manager, a technologist, or the person that actually sits at that front desk of the doctor's office can change what you do or support the organization's change to make this transition successful. And throughout this, I'll be discussing some organizations that are already building that bridge as they walk on it. So really quickly, let's get to the same page. This is information I know that a lot of folks have seen, but this will kind of set the stage for you. In a WEDI survey early this year, they said that 50% of health plans were going to begin testing by the end of 2013. Obviously, the change and the delay made that very different from 2012 when all health plans had expected to be testing. 50% of providers didn't know when their testing was going to occur even. And so we know this from organizations that we've currently been working with. Two-fifths of providers didn't really have any idea when their impact assessment would be completed or their business changes are going to be made. The vendors are beginning customer review and beta testing by the end of this year, and that's important because where do you fit in their lineup in order to get things done? And 40% of entities had delayed their timelines by at least 6 months, and I know from folks that we've worked with and folks that I've talked to out in the industry, you know, suddenly in the last few months they've sat up and said, oh my gosh, we have to do this. So all the time frames have shifted. But the bottom line is that if you haven't started, you can get through this, but only with very, very focused efforts. And I know there's a lot of folks that haven't begun because we do speak with them frequently. Just want to mention that today's ideas are actually focused on both inpatient and outpatient arenas. Because one of the groups that, you know, I find that I'm most concerned about that are at the biggest risk are smaller hospitals and also physicians' offices. And honestly, in my career, that's where I grew up, was in the physician's office. So I really do agree with most of my esteemed colleagues, if you look at any industry literature, that that these groups are the ones that are most at risk. So next, there's a polling question. And the question is, where's your organization on your ICD-10 journey? So let's figure that out from the group that we're talking to. And first, is it 20? Are you 25% complete? Are you 50%, 75%? Are you totally ready to rock and roll? Or do you have absolutely no idea where to start? So Lori and team are going to take care of that. And we'll start talking about, we're going to start talking about strategy and key organizational strategies. So rather than working in silos, you need to be aware that you can tie activities together, working them in tandem to accomplish your goals. So think about it from this perspective. what are some of the strategies or things that you're thinking about as you're working on your strategic plans in your organizations? Do you just want to achieve compliance of ICD-10 by October 1 of 2014? Are you going to educate providers? Or are there more overarching kinds of goals? For example, with a practice or hospital acquisitions, and I'm going to talk through an example about that in a minute. Are you looking to enhance your quality through meeting meaningful use stage 2 because you need ICD-10 there? Are you doing revenue cycle and transformation and optimization? I mean, that's going to be a big key in order to make all of this happen. Are you building your clinical documentation programs, or are you enhancing the program or tools that you have? Think about some of these other pieces about creating your alignment with community providers. You know, we do a lot of work, and we've talked to folks with Community Connect, but another way that you can create that alignment now is with training with ICD-10. Or do you just plain want to stay solvent and reduce the negative impact to your cash flow? So what's in your strategic plan? What are your goals for the next 3 to 5 years? And what are you doing around healthcare reform? And how can you tie all of these pieces in order to be successful with ICD-10? So here's a case study, and here's something to think about. That is, there's a hospital system, and they're in the U.S., and they've got 7, soon to be 8 hospitals, and they're growing. They have several hundred providers, more than 100 clinics, sites, and they're very, very geographically dispersed. Now, they've had a strong ICD-10 program moving. It's been led through IT, so that's another way to make sure that this transformation occurs. However, what they decided, because they have so many things going on at this point in time, especially strategically, lots of initiatives, is that now they had to do a couple of different things. So right now, they're doing a validation study to assure that everything is on track, where they are, where their gaps are, and how they're going to have to move forward. But the next thing is that in order to meet their strategic planning needs, they're refocusing their ICD-10 program, thereby centering that through a revenue cycle optimization and redesign to support the changing needs of their organization. So with that change, they're going to strategically be positioning themselves for their future. And that's one way to focus on this. They're going to use IT, of course, as the enabler to support through all of this process. So now, as you're considering the strategy and that kind of example of what it is you want to accomplish as an organization, think about what are the particular tactical pieces that can make that happen by defining the work that needs to be accomplished. So I don't think that I need to go over what the planning or transition process and gap analysis process is for ICD-10, because you can go to a HEMA, you can go to AMA, you can go to HIMSS. All that information is out there. I will make a couple of comments about this on the communication piece, is to make sure you communicate internally and externally. And a little bit later in this conversation, we'll talk about why the external partners are also so important in that communication. But the bottom line is that what you want to do through the transition process is improve processes and continue to measure as you transition in order to stay solvent. That's a bottom line. But I was reading the other day, an article, Ellen Van Buskirk, and she kind of defined measuring the effects of your business decision. And this talks about, because there's such a short period of time in order for this transition to occur, you need to understand your business decisions as you do your planning and definition. And I really like the way that she defined these. And this is an incredibly important for your physician offices and small hospitals with limited resources to be able to prioritize what they're doing. We had been working with a very large health system. I think they've got about 18 hospitals, several hundred physicians. And so for them, they focused on revenue cycle in order to get through, but they mapped about 2,000 processes. And then using a version of this model, they determined their actions moving forward in prioritization, moving each one of these out to their business groups to make it happen. So your planning and definition is very important, and right now you also have to look at what the effect of your business decisions are in order to move forward and make this happen. So you've also got to look at your organizational capability. Two things that are really important in this instance is that in this particular organization, they did not have a physician champion to assist in the communication and moving this forward. And I think more and more as we talk to folks, and I don't know about y'all, but we're finding that there are organizations that are challenged to have a physician champion step up to the plate. And so this is about working through the organization and figuring out who that person is rather than just putting all of the effort on one person. Sometimes it's one person that does it all. So here, this is the organizational capability to be able to move forward. The other thing has to do with some of the other initiatives and going back to the strategic things that are occurring. You know, this is what is your capability to be able to move forward. And I talk about revenue cycle, financial planning, revenue cycle optimization. The thoughts here as you're moving forward is what happens if your financial, in the financial impact if your revenue drops by 40%. So this is all about taking each one of the pieces. What's the showstopper in all of this? So as you look at what you're trying to accomplish as an organization moving forward, and even if it's just, of course, trying to get through the transition, look at all of these pieces and go back to if something fails in all of this or if you need to optimize some of it, what are the things that you're going to prioritize most moving forward, and then you'll go through each one of the other pieces. I was talking to someone the other day, and they were talking about the managed care piece and the contract renegotiation, and I thought they had a very nice idea and a little bit different way about looking at this, which is they're not doing a full frontal assault with their managed care payers to change the contracts. They're waiting for them to come up for renewal, and then they're adding language and working with the payers in order to make this move forward. You do need, that doesn't preclude you working with your payers right now, which you have to do. But when it comes to the contract renegotiation, they're doing this a little bit differently. So again, for you all, think about what are the things that are showstoppers, whether you're talking from the physician side or the hospital side where you have to move forward. The next piece are your key financial metrics. Now, I'm a finance person at heart, and so you have to track your metrics now in order to know where you've started, and then to be able to improve, and then to assure that when you make that intervention in your risk areas, that you've actually made a difference. And from here, I got this from a Weedy white paper that came out I think it was in January. So these are things that you need to think about. It doesn't make any difference if you're a small office, a large office, a hospital, strictly ambulatory, whatever. You still have to track what you're doing in order to know that all the interventions and all the actions that you've taken are effective or not effective moving forward. So let's think about this. So from a tactical standpoint, think about an academic medical center. This is all ambulatory, so it's all physician practice plan. It's in a hospital. It's in a town with 2 hospital partners. And what they've done, they have very limited resources. They have about 300 physicians. And they have not started their ICD-10 journey yet. So again, what they're doing and what they've decided from a strategic and tactical standpoint is that they're going to intertwine a revenue cycle redesign with their ICD-10 assessment and program. The other thing that they're going to do is they're going to partner with their hospitals for training so that that expense for them is not as significant as it is if they have to go out and contract on their own for training. So the bottom line is that in this instance, they know they're at risk from the front end, so that's where it's going to focus. Tactically, what they're going to do is improve their processes, doing things like maximizing their cash collections, i.e. their co-pays, because, you know, for a physician practice, that's where your margin is, and that's going to be in preparation for the transition. So here, the bottom line of what they know is that what they can tighten on the front end for them takes less of an effort of rework on the back end, and it will also help them decide who's touching codes, where they're touching codes, and what they have to change. But then as we know in our organizations, you really have to consider the constraints. And whether you're a large organization or a smaller one, you have to make those assumptions about your business and know where you'll be constrained in order to be able to move forward. So from that perspective, as you're moving through all of this, you need to find those areas of analysis and focus and understand where your gaps are. But do things like take your current workflows at face value. So if you've just implemented an EHR, use those workflows and work from there. Don't reinvent your wheel. Use prior history for the budgets. Use systems for your systems and applications inventory. Use information from the vendor and anything else that you have internally. I always think from a training standpoint, and because I come out of the ambulatory side of healthcare, I always also consider the impact of my turnover rates. I remember, I forget it was somewhere that I read that from a physician office standpoint, I think the turnover rates can be upwards of 20–25%. So that's really an operational impact for the physician's office to see what it is. That's a constraint for them to be able to move forward to figure out how to mitigate that particular risk and know that the siloed projects are not going to be successful. So you can't work these in a silo, which is what I'm talking about. You figure out how you collaborate and move forward. I think that one of the things that can be an absolute constraint is knowledge base. And this is just a faculty practice plan, and they were surveyed regarding ICD-10 when we started a project. And by the time we got done, only about 75% of them responded. But the thing is that they had at least 30% at this particular point in time, which was beginning of this year, that had no idea they had to code their billing encounters with ICD-10 codes by the 1st of October of 2014. In fact, almost a quarter of them didn't know what it was. And so that's really a communication issue moving forward. What do your providers know? What does your staff know? And how are you going to overcome that within your knowledge base? So those are constraints. And you need to, from there, you've got really tactical things we've talked about. And then you need to go back in and create your organizational structure. And there's lots of things you can do for steering committee and work groups. We've seen a lot of this, planning the strategy, creating the overall plan, and then setting up the ICD-10 steering committee. But from a work group perspective, I want you to look at that second bullet, which is identifying current teams and committees. One of the things that will help an organization move forward, especially at this point in time, rather than building a whole new structure, is looking at the organization and figuring out what current teams and committees are already in place and how you can use them in order to move this work forward. So if, for example, if you have a revenue cycle committee, use the revenue cycle committee. If you have a quality committee, use the quality committee instead of making separate work teams. And from there, it will make it a lot easier to move forward because you're not totally making a team that has to bond and move forward, and you're not also doing the death by meeting, which is difficult for us because we know we don't have enough time to get everything done. These are just full of examples of project structures. This is a very large organization and the way they put their organization together. This is an academic medical center, and this is how they decided to develop their project structure using clinical documentation, coding, training, technology, and business revenue cycle. Now, at this point in time, and there's a lot of people, of course, involved here. Here's a suggestion just for a very simple kind of project structure. And that is looking at whoever your sponsor is, if you're in a physician's office or a physician's group, maybe who that leader is along with the administrator, and then picking a small group to work together and having someone that can focus on this in some way, shape, or form, because you've got to have a focus in order to make this work. But your teams can be simple. You can have one team that's administration, operations, and finance, one team that really focuses in HIM, maybe one in quality, maybe one in information technology. And so any small kind of groups and teams could make this particular could make this work rather than, you know, the big projects. If you're a large organization, you absolutely have to have the big projects. But think about simple at this point and how to move this forward. You know, I think, you know, for some folks maybe that haven't started yet, this may be a really easy way to make that happen. This campaign is still going to take a lot of work, but maybe a simpler structure is going to work for these folks. So, you know, you also have to have some strategies for physician work structure. And I pulled this. I found this from Joe Nichols, and I've been using this slide for a while. In fact, we just talked to a group about clinical documentation and how that physicians really, a strategy for the docs and all the providers, as a matter of fact, is really to focus on patient care and documentation as opposed to coding. So I was talking to one group, and they're a small rural hospital, probably 120 beds or something like that, and they have their physician group, and what they decided to do, and this was a very big decision for them, was take the coding out of the hands of the physicians. And a lot of folks that we've talked to have said, you know, because this is all about the documentation, how do you help your providers deliver that patient care that they need to deliver, get the documentation up to snuff, and maybe not so much worry about the coding and look at different models as opposed to necessarily having the physician's code. That's just something to consider. So that's about promoting and expanding your clinical documentation initiatives using the training, the software, the CDSs, and automating whatever you can in order to make that happen. Educating your providers, and then going back to that, laying your metrics as a base. And then you monitor for all of the things, whether it's improved patient assessment, clinical documentation, coding, information, outcomes, and also improved business. So these are a lot of things that you can work towards. So I think that the message here really has to do with leveraging your existing infrastructure. So if you want to find out what's happening within your organization, rather than necessarily, you need to go talk to folks, but you can also start with online survey tools. SurveyMonkey is a really easy thing to do and put together to find out what they know, how to move forward. I will again say incorporate your work into already existing teams, and that will help you instead of having to have a lot of different work teams, work threads, whatever you might call them. Leverage your existing inventories. And then also use requests for information to obtain any updated information for vendors, whether it's you know, applications, systems, managed care contract partners, patient financial services, and business office. Any of these groups use email and in order to be able to contact them to find out what they're doing, how they're doing it, and how you can get in their queue in order to be able to make the transition happen in a good time frame for you. But leverage everything that you possibly have and can identify in order to make this transition easier. So one of the ways, and especially for folks with limited resources, I want to talk a little bit about leveraging the use of your partners, and that's internal, external, your trading partners, in order to be able to move forward. So I have one quick question. So there's a question I think coming up, and that has to do with leveraging your, yes?
This is Lori. I just wanted to let you know on the first polling question, 40% of the respondents are 25% complete. 20% of them are 50% complete. Another 20 feel like they're ready to rock and roll, and then the final 20 have no idea where to start.
Well, bless your hearts. You know, though, there's a lot of, thank you all for responding. There's a lot of resources out there, you know, to help, especially for those folks that really don't know where to start, and especially if you're smaller practices. So AHIMA, lots of places to go for that. So I hope that for those folks that are where they are, that some of this information is going to help. Lori, thanks for sharing that. So the next question is has to do with leveraging your relationships with external partners to complete your ICD-10 transition. And those are yes, no, or you haven't thought about that. So while you're doing that, let me talk about a safety
Chris,
net
it looks like most people are, most of the people have voted, and about 65% are saying yes, and 20 say they haven't even thought about it. 12 said no.
That's great. That's terrific, because we know that we have partners that we work with, It's how are we going to leverage them in order to move through this. And I have a really good example of this in particular, and this is one that's taken this to just a little bit different thought process. So they're a safety net hospital. They have 151 beds, and they appointed a very strong internal project manager. They have very clear direction from their executive leadership, but they've taken a very conservative approach because they have limited dollars because of the population that they serve. So they outsource, and they have a lot of external partners. So what they've done is they've started to utilize very strong partnerships with the proper metrics and controls in place, as a matter of fact. But their revenue cycle is outsourced. Their clinical documentation piece is outsourced. Their IT is very system specific, and that's outsourced. And so they've gone to all of those vendors and those external partners, and they are working towards agreements to make sure that each one of these groups is ICD-10 compliant, and how they're going to manage that within this transition. And I think it's, from them, this is a very creative way that they're moving forward within the transition with limited resources. And also what they're doing is they're also identifying each focus area, and they're assessing them one by one, slowly but surely, piece by piece, to make this happen. So for those folks that have a lot of external partners, this may be a way to move forward and be collaborative, because it is about the collaboration. So good for y'all. Here's some of the takeaways that we have in all of this. I can't strongly enough say identify your physician champions now. And those champions aren't necessarily your CMOs or your CMIOs or the CEOs of your practices. A lot of times they're informal leaders, and you just need to figure out who those folks are without, everybody's got a lot of work to do, without putting the load on the same people all the time. Back to collaboration. So we really need to look at collaborating to share services and resources. Work with industry associations for support and resources too. Call them into accountability. I live in Texas, and there is throughout I believe it's a Rural Health Association. They have worked with several organizations in order to bring vendors and in contact with providers in order to provide transition services to those rural hospitals and smaller practices that might not be able necessarily to do this on their own. So if you haven't done that within your state, you might want to think about how that could happen with you all. You need to leverage everything that you possibly can, whether it's people, processes, technology, all of that. And the other thing is identifying areas for standardization, centralization, and some increased efficiency. It's as I mentioned before, I grew up in physician practices, and one of the things I do know, especially when we implement technology, sometimes we don't always do that as well as we possibly can. And so what happens is that people end up overlaying process over process, and sometimes they're doing two processes, and it just makes it a lot harder. So it's incumbent upon us, I think, to be able to go back and figure out where we can make our processes better and more efficient. But we also have to bring our folks in at the same time. We have to ask them what they need in order to make this happen, and actually listen to them in the process. Communicate. In sales, what is it? A location. This is about the communication. I know that what people don't know, they tend to make up, and normally it's not always as positive as it can be. So this is about not just keeping senior management informed on this side, but communicate to everyone, internal and external partners. Know that there's really no shortcuts. We just have opportunities right now. And you need to think outside of the box. Think about the examples that I've shared with you all today for these organizations, whether they're large systems or physician practices or small hospitals, because I talked about all those all the way across the board. They're starting to think, and they've been thinking outside the box because they know that all these things have to happen. So just a thought, just remember that in order to change behavior, you've got to change the thinking. So think about what it is you want to change, why the change, which is that communication, of course, then back to your folks. Create your roadmap, align your team, implement your plan. My grandmother was a seamstress and I sew, and my mom always said, and my grandma both said, you measure twice and you cut once. And somebody said that to me the other day, and it kind of resonated with me for this, because even though there's not a lot of time for the ICD-10 transition now, we still need to take that time. We'd be a lot better off to take time to do all of these things with these takeaways and build a stronger infrastructure and process and be thinking outside the box. And then we'll be able to move forward, I think, a lot faster, especially for those folks that are still just starting. So there's 383 days left, and I keep this up on my computer just so that I remember. And I want to thank you for your time today. Perhaps I'll see you at MGMA or AHIMA in October, but I'm going to turn this to Jeanette Four from our company right now before we do questions, just to talk a little bit about Beacon Partners.
Thanks, Chris. Just wanted to say that Beacon Partners is one of the largest healthcare consulting firms in North America, and we help healthcare leaders improve operational, clinical, and financial performance, which ultimately leads to increased patient safety and better outcomes. Beacon Partners develops strategies and delivers services that provide the guidance and support needed to achieve enterprise initiatives such as EHR implementation, ACO readiness, ICD-10, meaningful use, business intelligence and analytics, and much more. With that, I'll pass back to Lori and Chris.
Okay, great. We can start the Q&A now, and I'll remind everybody that you can use the questions section on your GoToWebinar panel to pose the questions for Chris. Our first question is, how are your clients coordinating their ICD-10 program with other strategic initiatives? Chris?
Hi, thanks, Lori. They're doing, I think, a couple of different things, and this really has to do with, what we're talking about on the strategic side. It's if a client right now, so some folks that we're working with, like in the first example, they know that they need revenue. They're going to be acquiring hospitals and systems or other physician practices, and so what they're trying to do is figure out incrementally how they can make sure that as they bring these folks on in this time frame, because it could happen before October 1, 2014, how they're going to implement and integrate those folks in. So they're planning now from an operational standpoint. They're building onboarding processes, things like that, and they're also building some that's part of their due diligence, for example, as they're bringing on their new partners. From a meaningful use standpoint, or particularly from that strategy, some of our folks, some folks that I've talked to are still trying to work through meaningful use stage 1, I think, but for meaningful use stage 2, they're integrating their training for ICD-10 with the physicians, especially talking through and working with the quality people, because those quality indicators are key in ICD-10. So they're just trying to pull a lot of things together at once, or the ACOs has to come out with reporting, and so they're looking at business intelligence, and they're trying to figure out how to get the right information and the right metrics and reports back out. Just a lot of different things put together at once.
Okay. The next question, are there healthcare IT vendors that you see as leaders in the ICD-10 transition?
I would say that the majority of the large vendors are pretty much ready to go. I think some of the challenges are with some of the smaller vendors, or the ones that are more you know, kind of out-of-the-box solutions. I think there's a little more challenges, but the majority of your big ones, your Meditex, your Epics, GE, IDX, you know, the ones that fall in that cat, Siemens, you know, they're all pretty much there and ready to go. I haven't really seen anyone that's a leader over another. They all know they have to do it.
Okay, the next question, ICD-10 preparations include a large effort on the IT side. What specific tasks can you recommend in this area?
Well, first, I think that you have to have an idea of all your systems. So if you have an inventory that you did with 5010, you need to expand upon that, because what we find is that, I forget, there was an organization we were working with, and we found they had, I don't know, 400 or 500 apps that they were using, and you know, it was hospital and also physician practice. And the more that we dug, the more that we found more applications. So kind of long answer, short question. Understand all of your applications, how they're tied in together. Do a data map and know how your data is flowing within all of these key systems. The other thing that you need to do, a task, is to look at which one of those systems is more, go back to that catastrophic, you know, what's going to really stop your business, what's, you know, critical, and be able to even just red, yellow, green light your systems and prioritize them to know if this one totally stops, your business is going to stop. Well, if this system, you know, if the data doesn't come through this one particular system, it might only just have a small financial impact. So rate your systems for the number of people that use them and what kind of financial impact they have across the board. Have the inventory, rate the systems, and then make sure also that you go back to your vendors and know where you fall. If you've got to do those upgrades, know where you fall in their line to be able to get in to make sure the upgrades happen using your prioritized list. And don't forget your interfaces, because you've got to be able to get the information back and forth. The other thing from an IT standpoint is that you want to talk to your business partners and understand reports and the information that's coming out of these systems and how folks are using these reports, and help them from that perspective to know what data is in the reports and how you're still going to have to pull the data, and perhaps also how you're going to relate the pre and post data in order to be able to make business decisions going forward.
Okay, great. We've had a few people also ask questions about whether the presentation will be available for download, and it will be available in an email that we'll send as a follow-up to this webinar. Those are the only questions that have come in, Chris. So with that, we will conclude the webinar. I want to thank everyone for joining us today, and thank you, Chris, for an informative presentation. Again, watch your email for a link to the recording of the webinar, as well as any questions that may come in the next few minutes after we close. Okay? We look forward to seeing you at our next HIS Talk webinar.